evolution of optometry has gone on apace. We started as simple refracting opticians, we became optometrists, and since 2009, there's a growing group of what are called medical optometrists who can add real value to all of our patient care, but particularly for our contact lens patients. And I'm extremely proud to say that Aaron's is the only optometrist in Northumberland fully staffed with qualified medical optometrists who are able to supply continuity of optical and medical care for all our patients, not just our contact lens patients. What I need to do is convince you that there's real value in that service. So what would be the most appropriate skill base for a contact lens practitioner? Let's have a look at the evolution again. Okay, their contact lenses are an optical appliance. For sure, they correct vision. It's obvious an optical appliance. And because opticians are excellent at optics, and they were indeed integral to the developmental process of contact lenses, it makes perfect sense that contact lens practice is within the optician's remit. But it then became obvious that they are also a medical device, and they have impact on corneal and ocular health. But the medical pathway was not considered until 1976. And this is simply not part of a traditional optician's skill base and remains that way in the majority of cases. But now, finally, medical optometrists represent a service model bridging those two historic gaps in service provision. So contact lenses were designated as medical devices in 1976. Now, what does that mean? Well, a medical device poses a moderate risk to patient health when used without appropriate physician oversight, and that's the safety net. It's only without appropriate physician oversight that they pose a moderate risk. And it always seems very odd to me that it was not until 2009, that was 33 years after contact lenses were designated as medical devices, that the higher qualification of independent medical prescribing was introduced in the UK. And that higher qualification of medical optometry allows those clinicians to deal at a community level with this dual clinical need. But unfortunately, in a modern world, especially with internet sales and so on, the importance of that physician oversight is ignored or obscured, and we've got to really try to correct that. Let's consider the historic model of contact lens practice. Now, whether a medical optometrist or not, contact lenses are medical devices, as we've said. They are a risk factor for corneal infections. They are a significant cause of inflammatory events on the cornea and lids. So we fit the lenses, and when a problem arises, though, unless it's extremely straightforward, the clinician has no option but to refer to the hospital. And this is our normal. It's been our normal for 50 years, so nobody ever questions it. But it's actually counterintuitive. The clinical commissioning group has to foot the bill. So the poor old GP, who had absolutely nothing to do with any of the process involved, has to pay the hospital to sort the problems out. Absolutely counterintuitive. And this is despite contact lenses being designated medical devices since 1976. So appreciating that contact lenses are medical devices, I now want to consider various business models for the supply of contact lenses. Now, what we do, we have a totally transparent system. Just like internet sites, we take the contact lens commodity from the manufacturer, we add on a modest profit margin, and then we stick on our VAT, and that is the contact lens price to the consumer. But understandably, there's absolutely no clinical care incorporated in that transaction. And that's what internet sites do. Let's be honest, they're shopkeepers. They simply, it's like buying a can of beans. They buy the beans, they add on profit, they pass it on to you. Now, there's technically nothing wrong with that model, apart from the fact that we are dealing with a medical device that should carry a level of clinical care, and that's where the value is. Now, what optometrists do is they have the cost of the contact lenses, but they incorporate an overall cost that involves a certain level of clinical care, because it does cost money to supply contact lenses. There's the fee for professional service, fitting the lenses, aftercares to ensure ocular health and legal compliance. And hopefully there's a certain level in there to fund unscheduled emergency appointments. The problem is you don't know where the split is. And there's a huge range of services out there. There are some opticians who do a 10-minute check once a year just to tick a legal box. But if you turn up at any other time with an emergency or a worry, you're of no value to them. There's no money going in the till, so they send you straight to the hospital. The other extreme are, whether independent prescribing optometrists or not, that they have a really high-level service. You trust that clinician, and you know that if you walk in at any time and say, I've got a worry, they will find time to you and sort the problem out. So there's a huge range of services out there, and unfortunately, when you put all the prices together, it's difficult to tell what you're paying for. How much are the lenses? How much is the service? So we've introduced ages ago now our service Clarity. And it separates the cost of the lenses, as you can see on our website, from the professional services. Now, you don't have to like it, you don't have to want it, but we believe it's a professional service that's fair to everybody, and it allows you to transparently see what we're charging you. Now, of course, that throws down the gauntlet, because if we're going to supply a standalone, transparent medical service, it means we have to offer you a service of value to you, the patient. Now, okay, there are many advantages to being on Clarity, but the main one is immediate access to medical optometrists. There is always a medical optometrist on the premises. So if you walk in any day when we're open, we will see you. We cover 6 days a week with our resident medical optometrists. Now on Sundays, we also have a mobile number if we're monitoring a condition over a weekend. And we virtually never refer anybody to a hospital. And we treat directly with prescription drugs if necessary from our dispensary, or we write private prescriptions to get them. So it's a full-on medical service, and we feel it's a great value. So medical optometry really does reflect the total Aaron's business ethos. There's no point having one medical optometrist in a practice. My core clinical colleagues, Debbie and Andrew, have joined me as medical optometrists and are active prescribers. But our floor colleagues are also committed and vital members of the Aaron system. They triage patients when they ring, and they organise the clinic, because of course you can't always be sure when an emergency is going to turn up. And these things have absolutely non-quantifiable business value. Loyalty of the patients. You need continuity of care. You need to trust that your optometrist is not going to disappear. That they'll know you as a human being and be able to look after you. But also for my colleagues, because they have bought into the ethos, the business ethos, they stay. I've worked with Andrew since 1996. Debbie came to Aaron's as a pre-reg in 2007 and never left. So Andrew, Debbie and I like to believe, are maturing very nicely, thank you very much. But as I scream towards retirement, frankly, ready or not, I have to be thinking about continuing that very, very precious continuity of care. And at Aaron's, we don't just hire any optometrists. They have to be good and enthusiastic. So I'd like to welcome Sam and Sarah. Sam came to us as a pre-reg optometrist from Cardiff University, and Sarah has just come to us. She's an experienced optometrist, come to us from Morpeth and joined us just in January 2025. They're both actively pursuing medical status. I think Sarah will be qualified in a few months, Sam possibly next year. So welcome to the next generation of Aeron optometrists. So there you have it, a quick tour through medical optometry and how important it is, in our opinion, for our contact lens practice. So if you're not our patient already and you're a contact lens patient, if you are interested in or feel you might value a medical level of care, then I hope this helps you. Thank you very much for listening.